Hello, welcome to Spotlight on Souris, brought to you by WCG Access Channel 12, right here in Souris, Manitoba. Today is November 7th, 2018. My name is Laura Higgs, and today we have with us Colin McLeod, who is the pharmacist here in Souris at Whitfield's Drugs. Colin, you're here to talk to us about the flu shot.
Yes.
Welcome here.
Oh, thank you.
So tell me, what is the flu shot and who should have it?
So the flu shot is basically what we say is a killed virus. So it's actually something that is not living, but is made up of all virus parts. So what we do is we have a injection is actually a killed virus. So what it is actually parts of a virus that has been taken apart and basically rendered it won't harm you. So basically your body can develop antibodies against the virus and then obviously protect you against getting the influenza from those strains.
Right.
So this year's flu shot is actually made up of 4 different strains, all killed viruses, and they have decided that these particular strains are what's going to be most troublesome this year with people in Manitoba.
They decide that from last year's strains, right?
Yeah, they obviously they take cultures over the years of like people who do develop influenza to find out what virus they have, so that then they develop the viruses that are more common. So they try to protect it against the more common ones.
Right. Okay.
So people who should have the flu shot, obviously, it's for children from 6 to 23 months. There's also people with chronic lung, heart conditions should have it. Also, diabetic patients should have it just because their immune system can be a little bit less, not as strong as a normal person without it.
Right, they're so compromised.
Absolutely.
You know?
Anybody who is in a situation where they're exposed to people with lower immune systems, so
To protect them.
to protect the people that they're seeing. So
Right.
anybody who obviously works in a healthcare facility like a nursing home or a hospital, also emergency workers need to have it because obviously they're exposed to so many people during the day, or they don't know who they're going to be exposed to.
Cancer care workers.
Absolutely, yes. Anybody when you're dealing with, and actually anybody in the general public who actually, even if you go over to your grandmother and grandfather's house, just because of their age, their immune system can be actually lowered too as well. So it's basically everybody should have it. Those are the people that really need to have it. I mean, obviously, if a lot of people say, well, I'm healthy, I don't need it, but it's more of protection for the community and for other people around you.
Sure, sure. So why is the flu shot important? Well, we already covered that question, sorry.
Okay.
We basically flowed right into that question, right? So Mark will edit this out, and we'll go to number 3.
Okay.
So tell me, Colin, what are the common myths about the flu shot?
Okay. So one of the most common myths that I deal with is that the flu shot actually makes you sick. And that's not true. And people have gotten sick right after they have had the flu shot, and of course they blame it on that. But it's really not. If you were going to get sick, you were going to get sick anyways, regardless of the flu shot. So that's a common myth that it will make you sick. Now, saying that, there are a couple side effects. Like sometimes people do develop a little bit of a fever, but that's your body's natural reaction to, again, having that virus in you. And since it's not active, it's not going to be as obvious or as
prominent as the actual flu.
Absolutely.
Yeah,
yes.
so you don't have the flu, you have side effects from the flu shot, which are common and normal. You do not have the flu.
No.
Right.
If you have a slightly raised fever, you don't. But people do, however, like I've had a couple patients come in, and every time I get it, I get sick. Well, and I try to explain it, but unfortunately, they sometimes can't be convinced. But.
And there are some people who they don't know that they're already compromised when they get their flu shot.
True, yeah, and that's true too as well. Like if you are there is we do try to eliminate that possibility there's a questionnaire that you fill out.
Yeah, is anybody sick in your home? Because if you haven't had that flu yet, you're likely to get it if your partner or your family is sick.
Just because you're of close vicinity.
So let's wait another 7 days before we do this.
Absolutely, so that's what we do. So that's one of the more common myths is that the flu shot will make you sick. Another common myth is that you can get autism from it. That's another a myth that's come out. Actually, a doctor in Britain did a study about giving children vaccines based on autism and developing it. And he actually published this study, but the study was found by other people who went through the data to be basically null and void.
Have a lot of holes in
what
it.
he was doing, he was actually shifting the data so it would give him the results that he wanted. So it was absolutely false, and it's been disproven, but unfortunately some people see this on the internet and then
Roll
obviously
with it.
run with it. Yeah, and it's been totally disproven by many scientific communities. So that's another common myth. The other common myth is that the flu shot actually has mercury in it or other chemicals in it that can actually harm you.
Oh, I haven't heard that myth.
Thimerosal is what they commonly think of when they think about the vaccine and having that in it. And actually the vaccines don't include that anymore. They've taken it out because of people's concern, because they think that the mercury in the thimerosal actually will harm you, which isn't the case at all. But they've actually taken it right out of the vaccines now, so you don't even have it in
Have
there.
that to be of concern then.
No, and I mean, people sometimes are worried about the other, there are other, not only the influenza strains, there are other things that they put in there to elicit a response for your body. So it's almost like an adjunct to get your body to react to the virus,
Right.
just to make sure you have the immunity to it.
Right,
So.
right, okay. Okay, so where can people get the flu shot?
Well, you can obviously come to the pharmacy. I don't make appointments. You can just walk in and have the flu shot at any time. Obviously, with the rush at the pharmacy, it might be a couple minutes to.
Right,
few
and the
minutes wait.
questionnaire that we were talking about, you need time for that.
Yeah, there's a full questionnaire that you have to do. It's basically about a 10 to 12 questionnaire. Questions that you need to answer, like have you ever had a seizure before? There's a couple, have you ever had a reaction to a previous influenza shot?
Right.
Allergies to certain medications that could possibly be involved in the influenza vaccine. So it's a very short questionnaire. Most people know the answers to them right off the bat. It's not very a long process. Obviously, there are some categories that pharmacists can't. They can't give any vaccines to children under the age of 7. That's just a legality, so that has to be supervised by a physician.
Right.
So if you're 7 years old or older, you can come right in. Some of the questionnaires will be sort of red flags where the pharmacist may not give you the vaccine because of those answers, but that's very rare. I have never had that happen to me before, and I've given about 300 flu shots. So there's that questionnaire to fill out. So then you get the shot, the pharmacist will give it to you, and then you have to wait about 10 to 15 minutes after, just around the store. And that's just because if you ever have a reaction, it's very rare. I've never seen it before, but if you have an anaphylactic reaction to the vaccine, at least you're in the pharmacy, in the healthcare,
Right.
like the pharmacist.
It's
can-
best practice to
Absolutely.
do it that way, and over the years that I'd been given, when I worked in a clinic setting, all the flu shots I gave, I didn't see any reaction, and we had our people all wait.
Yeah,
But it's just
absolutely.
best
It's best
practice,
practice,
so
yeah.
we
And
don't want to
if-
scare people, but that's just
No.
what we do.
And if something ever happens, you don't want to be in your car or down the street
Yeah,
or something,
yeah.
nobody can see you. So
Exactly.
that's just the process. So it's about all entailed, probably about 25 minutes of your
Well,
day.
that's good.
And a lot of my customers just match it up with their coming in to fill a prescription. So
Yeah,
it's, oh,
yeah,
I'm in the
they're
flu shot
waiting
too.
anyway, right?
Absolutely.
Now,
So-
tell me, a red arm is not, it's a common side effect, it's not an allergic reaction,
No,
and
it's not.
uh,
No, and you will have, like, I've had a couple patients experience some burning sensation and the redness, and that's just your natural body's reaction to having a needle.
Well, yeah, a
Some
needle
people-
and fluids shoved in your muscle.
Absolutely,
really.
yeah. And a lot of people say, well, I can feel it go in, and that's a appropriate response.
Yeah.
Some people don't feel it at all, and it's fine.
Yeah.
But it's, again, that can be treated, like we can put, like you can ice the area, and you
Yeah.
can put some anti-itch cream if it's itchy or that, so.
Yeah, and don't
So
go
the-
out shoveling for a couple of days.
No,
Save
exactly.
that muscle.
Yeah, that's
Not
right.
that that's an excuse not to shovel. I'm just saying, don't overuse that muscle if
Absolutely.
it gives you a hard time.
Absolutely.
Right.
And usually a lot of patients, if they have that, will come back and say, this is happening, and
Mm-hmm.
we treat it like that. So other than the pharmacy, you can always go to a doctor's office. I know a lot of people do that with their regular checkups. Sometimes they get the flu shot there. They'll give it to you when you go in there.
Mm-hmm.
And also there is a clinic that I believe is in the next couple of weeks in Souris that actually the healthcare nurses or the public health nurses will put on. So if you can make it into that. I believe they require appointments to make that. So if you've made that appointment, or if you can make that appointment, you can always come into the pharmacy. So
Yeah.
there's that clinic too.
Yeah.
And just on an alternative, like there isn't a window particular that you have to have your flu shot in. So if you, like, I've given flu shots at the end of December, early January, and February.
Okay.
So that's also a possibility too.
So if somebody's a little bit compromised, not doing great this fall, and they think, oh, I've missed that
Yeah,
chance to get my
absolutely.
flu shot, when
You
they
still
get
can
better,
have it.
they can still come in and do that?
Absolutely.
Okay.
Also, if another thing that happens during the winter too is if you go away, just to make sure to have your flu shot when you come back, or we have a lot of snowbirds obviously that leave in the middle to end of October and don't come back until March. So if you
True.
can have it before you go, it's good. If you can't, then you should still have it when
Right.
you come back.
Right. Yeah.
So,
Yeah, 'cause
so
a lot
there's
of-
yeah,
A lot
there's
of people do go away early fall, and the vaccine isn't in until
Absolutely.
at least the end of
yeah,
October, November.
and a lot of questions I've had in the last week or two have been, if I'm going to a certain area in the United States or overseas, do they have different flu shots? And the answer to that is yes, they do have different flu shots, because obviously they do the same
Study and-
and they do the same research and
process.
find out which
Sure.
is there. Does that mean you shouldn't get the flu shot from here because you're going there? No, you should still have it,
Yeah.
because obviously you could get it. Some places may offer that flu shot when you go down there, and that is recommended. I mean, when it comes to the American healthcare system, there probably is a charge for it. I'm not sure off the top of my head what that would be, but it still would be worth it, because obviously if you go down to a place like South Phoenix, in my experience actually, my in-laws go down every year at Phoenix, and you obviously get people from all different parts of the United States and Canada into one area. So if one of them is carrying an influenza virus, they'll bring it
We
with
love to
them.
share.
That's right, exactly. So it's always a good idea to have it
Yeah.
as soon as you can, and even if it's late, it's still better than not having it. So,
Right, okay. Okay, so what is the cost of the flu shot to
It's
us Canadians?
absolutely free. So you can just
Okay.
come in, all you have to do is sign the document. One of the other processes that we do, which is involved with the questionnaire, is in Manitoba, we take your health card number and we actually put it into the drug system, like
Okay.
the drug network.
Right.
So it shows up on your file
profile.
that you've had it, so that if you get admitted to a hospital, or if something happens where they think you haven't had it, they can check those records. So we
Great.
automatically put that on the file.
Oh, good,
So,
good. So that's good to look
Yeah.
up, just like any vaccine. When people come in, you need to know if they're updated. If they can't remember, you like to look it up.
yeah, and especially with that system, like it keeps records for for months and stuff. So obviously, if you've had it last year, of course you're going to get the new one every year.
Right.
So, but just in case you get admitted in that 6 months after, so
Right.
yeah, absolutely.
Okay, so absolutely free in Canada now. Okay, so if you get the flu anyway, okay, after receiving the shot, what is that going to look like, and what should you do about it?
Well, if you're unfortunately get it, obviously you have to look at the signs. Like, a lot of people can confuse a regular cold to influenza. So there are a couple telltale signs that
Okay.
you do have influenza. One of them is a very high fever. If you have a cold, that is uncommon that you would have that, and it usually doesn't happen. There's also a severe headache that would come with influenza, and also a lot of fatigue, like extreme fatigue, where you feel like you can't get out of bed, you just don't have enough energy.
Sore from head to toe.
Absolutely, yeah. So those are the most common ones that are. Everybody comes in and they sort of say, well, I have the flu, but they won't have those symptoms, so you probably just have a cold. So if you do have those three symptoms, you probably do have an influenza. Now, there are, obviously, with the flu, you probably have to basically, treat the symptoms. We would prescribe you some ibuprofen or Tylenol for the headache, and lots of rest, keep your fluids up, absolutely. So, and probably stay away from work would be a good idea too as well, because you obviously don't want that spreading around work or anyway. So, and also if you want to take some precautionary measures at home, you probably should maybe wear a mask, just wear a mask around the house, especially if you're dealing with young ones, or if you're going to visit grandparents or such, because again, if you expose them to that, they can get really sick. So,
And if you have those symptoms and you have a cold, you really should take some time off
Yeah,
and look
that's
after
right.
yourself.
Yeah, absolutely.
Because then you've got the combination flu, cold, and it's not
it's
good.
not good. No, not at all.
Not
But yeah,
good.
those three telltale signs are what
And you
should
did
look
not
for.
get it from the flu shot.
No.
You were compromised, or you were actually infected prior to the flu
that,
shot,
yeah.
right?
Yeah, and it's tough to, it's obviously, when you always, it's human, basically human kind's always response is logically they want to blame
Yeah,
something.
yeah,
'Cause,
that's
you know,
right.
and obviously
That's
that
right.
that you know what, you gave me the vaccine and I
And then
got
I was sick.
and then it must have been that,
Yeah.
and it really isn't. And it's, you know, it's tough to convince people, but a lot of people do eventually come around.
Well, and it's the season. It is the season for colds and flus.
Absolutely.
We start being confined and we start sharing germs
Yeah,
because we love to
absolutely.
share. So that's why they give the flu shot in the fall, because this is a bad time.
Well, and influenza can be like, unfortunately, in the wrong age group or wrong person, it can cause death. And
It
people
absolutely
don't
can.
understand that, you know, I mean, again, convincing a healthy young man or woman to do it, and I'm never sick, that's awesome. That's great. You're never sick. But it's the people that you can expose it to that it basically can cripple them or kill them.
Yeah.
And it's very, it's something you have to convince the public about. It's not always about you.
Yeah.
Like, I mean, we were talking before about the herd immunity, right? So the idea that the more people that get vaccinated protects the people who don't or are compromised. So
Or
in that,
can't.
or
Yeah.
can't, exactly, or have a condition.
Because
where-
there's confined elevators, there's airplanes.
Oh,
There's a
it's
lot of
everything.
places
It's
where you
everything.
share air with people and you don't even
Absolutely.
realize it.
Well, absolutely, and I mean, in this day and age, you can, you know, you can see, like, if you travel in the summertime, you could see different people every day, and it's just back and forth. You trade it.
And for the most part, people don't realize this, but for the most part, you're already contagious before you have signs and symptoms
That's
of
true.
having the flu.
Absolutely, right.
So you're out there sharing those germs
Yeah.
before you have signs and symptoms. So if you get the flu shot, you're not going to be sharing those things when you don't know that you have the flu,
Absolutely,
right?
yeah,
So
absolutely.
it's
Like,
a
it's
good-
preventative. It's tough again to, you know, to convince people to get that, just because, like, again, you may not even, you know, you may not even show the signs, like, or you have a very, because you are a healthy person, the symptoms may be really minor for
Vague,
you,
vague,
absolutely,
right.
or mild, and you might not
Yeah.
notice it. But again, to the wrong person, it could be deadly. So
Yeah.
you have to. It's very important that everybody get a flu shot, just to prevent those things from happening.
Okay,
So.
well, that's great. Well, thank you so much for coming in.
Thank you.
And sharing with us about the flu shot and the flu season. And the people of Souris, of our community, can come and find you at the pharmacy.
Yeah,
Colin,
absolutely.
and they can not book an appointment with you,
No,
just
you
come in and
walk
see
in
you.
anytime. Like I
But-
said, it'll be 20 minutes.
But try to have
maximum.
20, 25 minutes available
Yeah,
to get this
I
done.
mean, a lot of people do come in and they're like, they don't want to wait, and I understand. You know, you have work constraints, and you obviously, you know, you don't want to sit on a bench in the pharmacy. You know, time
Well, they could
time
book
is time, right?
book an appointment, I guess, then with the public
Oh,
health and
well,
also do it that way?
They
Or
can do
doctor?
that too. Well, and a lot of things too is what I always recommend too is actually the questionnaire is actually, I can just tear it and give it to you. So if you don't have time that particular day, you
Oh.
can take the questionnaire. I mean, obviously it speeds up the process
Right,
a little bit,
right.
so then you just bring it in and then we can do that right
Bring it
away.
in,
So-
you just review it with them, and then
Yeah,
you carry on with the flu
absolutely.
shot. Okay, that's great. So people can find you at Whitfield Drugstore,
You bet.
and they can come in, and you're open Monday to Friday.
Monday, Friday, 9 to
Days, 9 to
6.
6.
Yeah, there's no bad time to come in. Just come in whenever you can and get it done.
Right, okay. Thank you so much for your time.
Thank you.
Thank you for joining us here on Spotlight on Souris. I'd like to thank Mark Cranwell, who is our cameraman today, Sheila Kirkup, who is our producer. My name is Laura Higgs. Have a great day.